having trouble remembering names of common things like tables, chairs, books, paperclip, those sorts of things. And people are like filling in for the things that are missing. So all of those would be abnormal memory problems. The other thing that's a good clue as to whether the memory is normal or not is whether or not your family or your friends are concerned. That's another good tip. So that's a little bit about normal and abnormal memory. It says into the next part of the talk, which is to start to talk about the causes of memory trouble when it is more than just normal aging. And so there are questions about what's the earliest that people are diagnosed with the disease, and a little bit about what type of memory is lost. So the answer to the question about the earliest age in which someone is diagnosed, it probably is around age 30, age 35. And these are individuals who live as part of a family that have a genetic disorder that causes Alzheimer's disease. It's very rare. I'm almost certain that no one in this room is any part of this, or probably even knows anyone who has this. The largest family that has this, which this family has over 4,000 people in it, over 1,000 people have Alzheimer's disease, and they live in Colombia, South America. And some of you may have read articles in the New York Times about this family that has this genetic mutation. I'm pleased to say we actually have done some studies on this family to try to better understand the disorder. But in terms of the more typical onset of Alzheimer's disease, the way we all think about it is really a disorder that probably most people come to attention somewhere between the middle to late 60s up until the 80s and maybe even to the 90s. So most people are developing Alzheimer's in their 70s and 80s with going 10 years either way. Some people in their 60s, some people in their 90s. Let me talk a little bit more generally. So memory loss can be due to a lot of different causes when it's not just normal aging. And the most common cause in an older adult, once you've ruled out the sort of medical causes that your primary care doctor can do very quickly, is Alzheimer's disease. And let's talk for a second about the difference between Alzheimer's and dementia. So dementia is anything that causes a progressive loss of memory function or other cognitive abilities, other thinking abilities. Thinking abilities can include things like language, or ability to sort of find one's way around and not get lost, or ability to do any sort of complex task, like hook up a new DVD player or plan a holiday meal. Those would be executive function. And dementia is anything that does that. Alzheimer's is one type, and that type has a specific cause that we'll talk about. There's other types as well. There's vascular dementia, which is dementia due to stroke. There is frontotemporal dementia, which presents in a different way. There's dementia with Lewy bodies, or Parkinson's disease dementia, that, as it sounds, has Parkinson's symptoms as well. So the way I think about it is dementia is like a big umbrella category that encompasses a lot of different individual disorders. Alzheimer's just being one of those, but it's the most common. So Alzheimer's represents the cause of about 75%, or 3/4 of all of the different types of dementia. Now, Alzheimer's has two different abnormal proteins that build up in the brain. One of them beta amyloid, and the other is called tau. Now, the beta amyloid forms plaques in the brain. The tau develops into these tangles inside the neurons after the plaques start. And our current understanding is the plaques start, they damage the neurons develop these tangles, and then the neurons are killed, and some of the brain cells die. Now, I want everyone to understand that the plaques that develop from the beta amyloid in the brain are different from any other plaques in the body. They're not the plaques that you find on your teeth, okay? You don't need to worry that it's because you didn't brush your teeth well enough. You know, I told my husband to brush his teeth. Now he's got Alzheimer's. No, it's not. It's a different type of plaque. And it's also a different type of plaque than a cholesterol plaque building up on the arteries. It's a different type of plaque. So it's really just, a plaque just means like schmutz, just like stuff, that's collected there. So we believe that it starts off with these beta amyloid plaques, and then it damages the neurons, and they develop these tangles. Now, because the part of the brain that is damaged first is a structure called the hippocampus, and the hippocampus is what's in charge of forming new memories. That's what patients with Alzheimer's disease have the biggest problem with. They have the biggest problem with new memories. So when you were asking me, is it short-term memories or long-term memories? The answer is, if by short-term memories you mean things that happened recently, things that happened yesterday or the day before, the week before, the month before, and by long-term memories, things that might have happened 10, 20, 30, 40, 50 years ago, then the answer is that short-term memories is what's affected by Alzheimer's disease. And it's very simply because the part of the brain that's affected is the part of the brain that's in charge of forming new memories. So a typical story that I will hear is, I just have short-term memory problems, Doc. You know, I can remember everything that happened, 30 years ago. I just can't remember what happened yesterday. So that would be a very common history. And in fact, more often, the patient talks more and more and more about things that happened 20, 30, 40, 50 years ago, because those are the things that are left. When you can't remember anything that happened over the last weeks, months, or a year or so, and all you can remember is things that happened 30, 40, 50 years ago, those are the things at the top of your mind, and the old stories come back again and again. The old stories may be told perfectly, without any errors. But if they can't remember what happened yesterday, that is a sign that it could be Alzheimer's. In fact, it's that difference between actually memory not being so bad for things that happened a long time ago and not being able to remember what happened yesterday, that actually will make me think, geez, I think this is Alzheimer's disease that we're dealing with. Now, I want to take another minute before I answer more questions and tell you a little bit about how we treat Alzheimer's disease. So there's currently two different ways we can treat it. The first is we can improve the symptoms of the disease. We can make the thinking and memory better. And we can do this by using two different types of medications. The first one I want to mention, which is also, I think, the best class of medicines, the most important class of medicines, are medicines that are and the generic is just as good. Other medicines in this class include galantamine and Exelon, which is also called rivastigmine. So those are basically 3 drugs that all work in the same way, but I got 5 different names for you because 2 of them have 2 names. So those are the mainstay of therapy. We call them cholinesterase inhibitors. Medication is approved specifically for the moderate to severe stage of Alzheimer's disease. And this medication is called Namenda, and its generic name is memantine. And it is a good add-on medication. So somebody's already on Aricept or a similar drug, and they're hitting the moderate to severe stage. That's a good time to add Namenda or memantine, and if people want, we can talk a little bit more detail of when I do and when I don't prescribe these different drugs and the side effects and things like that. If people have questions about those, we can go into more details on them. So that's the first way that we treat is with the FDA-approved drugs. Now, the next thing that we look into, especially at the Boston Center for Memory, where I work, one of my jobs, is that we are trying to give people access to the latest treatments. Treatments that are not even out and readily available in the marketplace. So these are medications that are available through clinical trials. And there are clinical trials of several different symptomatic drugs. So these are things that can be added to the donepezil, added to the Aricept, added to these leads, instead of saying, well, geez, I'm going to be worried that by the time you're 82, pretty much, all the function's going to be gone, to move that till it's like 94, or 106, or something like that, by the time the Alzheimer's disease will really take hold of them and rob them of all of their functions. And so that's the real exciting thing that's going on. And what the studies suggest is basically there are different things that we can do at different stages of the disease. Some of the symptomatic medications work best in the mild stage. Some work best in the moderate to severe stage. Some of the antibodies work the best in the earliest stage, such as mild or very mild, or even before Alzheimer's would be formally diagnosed, in what we call mild cognitive impairment, where we think it's coming, but it's not even there yet. And other antibodies may work better in stages of the disease that are more into the moderate stage. So what I'm trying to say here is that, number one, it's never too early to get checked out if one is concerned about it or you're concerned about a family member, because there's things that one can do. And if some of these new drugs that can remove the plaques from the brain are going to work, it's best to start as early as possible. It's best to start as early as possible. But the other message that I want to convey is there are things that we can do to help